flexion and in a supine position. So for Rob, I'm gonna get him to pulse
Way to fell off.
bicep just like this. Perfect. And so for the long head, the apex of the coracoid process of the scapula, sorry, I think, did I get those correct? Yes. We're gonna find the coracoid process, just like we did before. Some deep in there. Getting a little bit of a tense. If you need to just do a little bit of resistance. Yeah, thank you. So we're getting the short head. Yeah. And relax. Great. And then the long head is going to be really difficult to palpate because if we look at where the supraglenoid tubercle of the scapula is, it's buried right under the acromion process and really deep to
deltoids and
the deltoids, and it's even deep to the coracoid process. So if you think about how difficult it is to get into some coracoid processes, we won't be able to palpate it. So we're going to take the tendon, as we've been doing, right up and through the intertubercular groove, and then just pulse there. Great. And then we'll follow it all the way up to just under the acromion process where we lose it. And that's going to be about as close as we can go. So then we have the short head and the long head coming down in their tendons, and then keep pulsing. Perfect. And then we can see how it turns into a more significant muscle belly right here, where you can almost pick up the bicep, both sides. And then as we get just right above the cubital fossa, you can relax. It narrows significantly, and it'll taper into a tendon. They can almost pinch on both sides. And then just careful working around the elbow because of all the different structures. And then onto the radial tuberosity. I'll get you to pulse again. There we go. So the radial tuberosity again is going to be deep, and then it might feel like there's a little bit of a diffuse insertion because of the bicipital aponeurosis. So that's going to be.
I could definitely feel it when I was doing it to myself.
Yeah. If you go medially, it's just going to be this
like
thickening.
Webs out almost.
Yeah. Thickening web of a tendon. Medially. So we have our bicipital aponeurosis right there. Perfect. And relax. And then for brachialis, we're going to rotate the elbow into pronation, and then we're going to do the same thing. The little pulse, except now we're looking for the distal half of the anterior aspect. So that's going to be deep to the bicep brachii, and you can feel a little bit of a pulse on the lateral side. And then if I'm here, not as much medial, but if you get underneath, there's a little bit of a pulse. Medial, go up high enough. It's not pulsing there. Here we go, a little bit more muscle belly coming underneath. And then relax. And we're going to get onto the ulna, and then the coronoid process, which remember is really deep right in there. So it's going to be difficult because you want to like pronate, so that's hiding the coronoid process, and then pulse here. So if you supinate the arm, locate where you assume the coronoid process should be. So if you take the olecranon, it should be right on the other side of the olecranon, right? With the radius being more lateral. Keep your finger there, pronate, and then you should get a little bit more the muscle, yeah, tendon inserting right there. Perfect, and relax. Awesome. So the resisted